Supplements. So, there are supplements that will help you not to get sick. And that is specifically vitamin D. As you know, vitamin D has tons of researches in the last few years that not only talk about calcium absorption, what it does, but also talks about optimal immune system. It turns out if you measure your vitamin D level, next time you get a blood test, and you will notice, even as you're living in LA, that your vitamin D level is low, either for many people below even the low side of the norm, 30 to 100 is the range, or for some people it's in the low 30s, unless you take vitamin D. So now it turns out you have to be around 50 to 100, ideally around 75, at least above 50, to have that immune stimulative effect. And this immune stimulative effect is also an anti-cancer effect. So pushing your vitamin D level up in this higher range is very, very worth it. And it's probably the cheapest way of prevention. Yeah, there's a study out that says how many lives do we save by following the recommendations of the dermatologist not to be in the sun. Okay? So skin cancer and what have you. Melanoma, which kills around 4,000 people a year in America. Staying out of the sun and having low vitamin D level, per estimation, will kill about 60,000 people a year in America. Yeah, interesting. Yeah. So if you don't look at the whole picture, it doesn't mean if you're a pale Scot, red-haired Scot, you should hang out in the sun too much. Yeah, that's stupid. But at least you should take your vitamin D. And take enough of it in order to reach these higher realms, which normally the 400 and 800 units don't cut it. 2,000 rarely does it, 4,000, 5,000 normally does, and some people doesn't do it before 10,000. Okay, which is huge, because then you read the studies that say, well, 10,000 is clearly too much and more than 2,000 is not safe. Well, but they don't measure your levels. It's just a general recommendation against what you would throw at the general population, and I agree with that. But now we're doing individualized medicine, and look where you are specifically, and then you should be in this higher range. Yeah, profoundly preventative, including viruses and flus. Then obviously all the antioxidants from C to E are important. Selenium, zinc, as you know, in the acute stages of flu, zinc lozenges work great, yeah, stimulate the immune system. Tons of studies about that. Obviously fiber, important, what I mentioned before, preventatively, to prevent you from getting sick. Omega-3s prevents you from getting sick. Yeah, just when you come down with something, you stop it for a while. And these are the important things. Now, multivitamin, you probably heard about the study that just came out a few days ago. When was it? Yesterday? Day before yesterday, that women who take a multivitamin die prematurely. Yeah, it's one of these studies that often show up, and whenever there's something negative about nutrition, it gets big press. It's just a tradition in this country. Now, as it turned out, what they say is predominantly women, these are all postmenopausal women, predominantly women, the strongest indicator was who take iron in their multi. Now, who in the first place would give a postmenopausal woman iron? You know? Unless there is a specific anemia, or bleeding disorder, or what have you. Yeah, after menopause, you should not take a multi with iron. Every kind of nutrition-oriented person does know that you should give men iron, because iron overload is not healthy for you. Yeah, too much iron basically rosts us, causes oxidative stress in the body, and turns out viruses and bacteria love iron because, same like with your plant outside in your garden, it's a growth factor. Okay, you just can throw iron on a plant and it likes it. It's the same thing with bacteria. So you do need to be careful about iron. So the paradox about this study was to say, well, this group of people, I think they tested over 10,000 people, they were healthier and felt better but died prematurely. And we don't know what it had to do with the vitamins, but that was an association. You know, that's a totally ridiculous study. I mean, someone who feels better and is less sick dies early makes no sense. Yeah? So the whole thing comes down to the fact that many studies are not causative, but associative. You understand the difference? And many things can be associated with each other. You know, the stork on the village means there's more births, you know, statistically proven, has normally, as far as I'm aware of, nothing to do with each other. Yeah? So you have to be very careful what you read. And unfortunately, talking about antioxidants, remember beta-carotene stimulates lung cancer in smokers, increased risk if you take beta-carotene. Vitamin C does not work. 30,000 people took vitamin C, does not work for viruses or flus or immune stimulation. You have to read the small text. Yeah? If you do study one substance of the immune system, one antioxidant, you will do harm because that's not how the body works. Yeah? If you give, let's say, beta-carotene, which is an antioxidant, it will provide an electron and support the tissues, has a healing effect on tissues, and then it becomes a free radical itself. Yeah? Because it gives up this electron, and here it is. And normally then vitamin C, that does the same thing, gives its electron, becomes an oxidative agent, passes on to vitamin E, and here it goes. It's a whole chain of events. It's like you're saying, well, let me see whether broccoli is healthy, okay? And I only give you broccoli to eat. And after 2 months, you're going to be sick and tired and look lousy, and the conclusion is broccoli is bad for you. Well, it's not. But if you only do broccoli, if you only do beta-carotene, it's ridiculous nutritionally. Yeah? And that's where many of these negative studies come from, unfortunately. So you have to be very careful. These vitamin C studies, huge studies with 200 milligrams. Well, that's a joke. You know, our vitamin C doesn't work. Well, 200 milligrams, well, that's double the RDA. Okay? But that's nothing, because the RDA is a joke. It's a joke in order to prevent scurvy. That's all it does. You taking 20 milligrams of vitamin C prevents scurvy. Now it turns out that, let's talk about vitamin C for a moment, because it's a good topic and important for us, immune system. Turns out that humans don't produce vitamin C. And why are guinea pigs guinea pigs? That means why are guinea pigs susceptible to disease and used in labs to do research on diseases? Why? Exactly. Like us humans, we and the guinea pigs lost the ability to produce vitamin C. Yeah, we still have the genes somewhere in there, but we don't have the machinery to produce that. Yeah, it's fascinating. So if you translate, every animal out there produces vitamin C in themselves. We don't. So now you get a better understanding why eating vegetables and greens and some fruit and berries is so important, because we need to take it from the outside, but we don't produce from the inside. Turns out, if you would now extrapolate our body weight and compare it how much vitamin C would we, if we still would have the capacity to do that compared to other animals, would we produce, it would be about between 3 and 6 grams a day. 3 to 6 grams a day, 6,000 milligrams, not 200, 6,000. Okay, and that's where a huge difference comes in, a huge difference. Because in order for vitamin C to be effective, the 200 milligrams will be great for you to prevent scurvy, if you want to do that. That's not your problem normally. Yeah, but if you want to have a healthy preventive immune system, you have to take a few thousand a day at least.